Mr. President, I would like to talk about the latest attempt from my colleagues on the other side of the aisle to upend our health care system. They've been trying to sell this as a new and better health care bill, but in fact, they somehow have managed to come up with something even worse than the previous Trump care bills. It would repeal the Affordable Care Act, gutting key protections for people with pre-existing conditions and ending Medicaid as we know it. I want to recognize some of my colleagues, however, on the other side of the aisle who have already stood up to this effort, because no matter how many changes have been made to gain the support of senators, this bill would be devastating to every state, including my home state of Rhode Island. Senate Republicans are trying to hide the impact of the bill, potentially forcing a vote before the nonpartisan Congressional Budget Office is even able to publish a full score and analysis of the bill, including estimates for how many people would lose coverage and how health care costs would be affected. Late yesterday, we received a preliminary estimate from CBO saying that, similar to previous Trump care bills, this proposal would leave millions more Americans without health insurance because of massive cuts to Medicaid. We won't see a more detailed score for weeks. And yet, the majority is attempting to rush this through in order to use budget rules that expire on Saturday that enable passage of this bill with just 51 votes. Fortunately, a number of nonpartisan organizations are publishing data on the latest bill, and they all agree that this bill would have a similar impact as the previous Trump care bills. Tens of millions of Americans would lose coverage, state budgets would be decimated, and costs would increase, especially for those with pre-existing conditions who would be priced out of the market entirely. According to one of these organizations, Avalera, Rhode Island is slated to lose $3 billion by 2027, and the cuts only get worse from there. Medicaid would be cut drastically, meaning our most vulnerable citizens would lose access to health care, including children, people with disabilities, and seniors. Over 60% of nursing home residents in Rhode Island access care through Medicaid, and half of Medicaid spending is on these long-term care services. It would become impossible to protect these programs from the cuts projected under this bill. In fact, states would be forced to cut not only health care, but also education and infrastructure and other priorities to make up, or try to make up, and I think try to make up is a better word to use, the difference. This would be nothing short of a crisis in every state in this country. We have already spent so much time this year having this fight, time we could have spent working across the aisle to improve health care, to end sequestration, and ensure a stable federal budget to improve our economy. In fact, after the efforts to pass Trump care failed just 2 months ago, Republicans and Democrats on the Senate Health, Education, Labor, and Pensions Committee joined together in a bipartisan fashion to come up with a bill that would improve our health care system and lower costs for everyone. Significant progress on this effort has been made. However, by resurrecting this Trump care debate, we are again on the brink of voting over whether or not to kick millions of Americans off of their health insurance. With this effort, Republicans are taking our health care system hostage again as deadlines approach this week for finalizing insurance rates for the next year. Health insurance commissioners and other experts have already said that the instability in Washington has caused rates to increase. Yet my colleagues on the other side of the aisle continue down this destructive path. What's especially egregious is that in addition to the jettison of ACA stabilization efforts, we also need to extend funding for other critical bipartisan health care priorities, like the Children's Health Insurance Program and the community health centers, whose federal funding expires in just a couple of days. In fact, the chairman and ranking member of the Senate Finance Committee had come to a bipartisan agreement to extend funding for CHIP for 5 years, providing stability and assurances for states and families across the country. However, that work is now on hold, just like the critical ACA stabilization effort. We must continue to make our voices heard and show the majority that this is not what the American people want. They want us to work together to strengthen health care, increase access, and keep costs down. The enormous outpouring of citizen opposition and healthcare experts criticizing Trump care over the summer was a really powerful statement about what the American people my constituents and people across the country believe should be the path forward on health care. As my colleagues work to make last-minute changes to the bill and conceal the real impacts by refusing to hold substantive hearings and rushing new versions of the bill to the floor with little or no warnings, my constituents are not fooled. They continue to write to me, urging me to keep up the opposition to Trump Care. Just a week or two ago, I heard from Barbara in Middletown, Rhode Island. Her mother has Alzheimer's disease and relies on Medicaid for long-term care. Her sister has Down syndrome and has recently been diagnosed with Alzheimer's disease as well. She also relies on Medicaid for her health care. This new proposal, just like the previous proposals, would be devastating to Barbara and her family. I urge my colleagues to really think about who would be impacted by this legislation. Whether or not you like Obamacare or voted for it 7 years ago, this latest Trump Care bill is not the solution. I will continue to oppose these efforts and hope to work with my colleagues to improve our health care system and lower costs for everyone. And with that, Mr. President, I would yield the floor.